now that we've talked about how we form urine and all of the processes that go into this and what the normal composition and abnormal things that you may find in urine are, let's talk about how we move this urine through the body, where we store it, and how we get rid of it. So remember, from the nephrons draining into the collecting ducts, the urine then is going to drain into the minor calyces that are going to merge to form major calyces that all unite to form the renal pelvis. From the renal pelvis, the urine is going to drain into the ureters, and then the ureters fill the urinary bladder, and the urine is eliminated from the body through the urethra. So let's start with the ureters. They're going to transport the urine from the renal pelvis of each of the kidneys to the urinary bladder, and there are peristaltic contractions of the smooth muscle of the ureters that are going to push that urine toward the urinary bladder. But there's also just simple hydrostatic pressure and gravity that help to move that urine. The ureters are about 25 to 30 centimeters or 10 to 12 inches long, and there's no anatomical valve at the opening of the ureters into the urinary bladder. But the urinary bladder fills with urine, and then pressure within the bladder sort of pushes back on the openings of the ureter and prevents backflow of the urine. When this is not working properly, it's possible for bacteria, yeast, for any type of abnormality, something that is in the bladder, to push back and get into the ureters and then backflow into the urinary bladder and infect the kidneys as well. So the ureters transport urine to the bladder. So the bladder is a hollow and distensible or stretchable organ surrounded by muscle. We know it's located in the pelvic cavity, posterior to the pubic symphysis. In males, it's directly anterior to the rectum. In females, it's anterior to the vagina and inferior to the uterus. The average capacity is about 700 to 800 milliliters. It's smaller somewhat in the females because the uterus does compress it just a little bit. Now, let's look at some of the structures in the urinary bladder. So here you see the ureters coming in. So your ureters are going to leave the kidneys and come down to fill the urinary bladder. So the urinary bladder has folds within, just like the stomach, and these are called rugae. So these folds of the mucosal layer that lines the bladder allows the bladder to expand. You also see the detrusor muscle that surrounds the urinary bladder, and when it contracts, of course, it's going to help to push that urine down into the urethra. The urethra is the tubular structure that's going to run through the pelvic floor and, of course, empty to the external environment through the external urethral orifice so that we can expel that urine. This area right here. Now, the ureters don't empty into the bladder where you see them here at the superior border. They empty much lower in the urinary bladder. So if you look at this triangle, this is an area known as the trigony. So the 2 points of the triangle here are where the ureters open, and then the 3rd point of the triangle, the apex of the triangle, is where the urethral orifice, the internal opening to the urethra, is located. So when the detrusor muscle contracts, it's pushing urine downward. Now, in order for that urine to exit, we have to relax sphincter muscles. So you have an internal urethral sphincter that is involuntary, and this is the one that is going to relax due to the pressure of that urine pushing downward as the bladder starts to accumulate the urine. The external urethral sphincter is in the deep muscles of the perineum, so the pelvic floor, and these are the muscles that you have voluntary control over so that you can control, once you learn to control these muscles as a young child, you learn to control, to constrict and relax these muscles in order to urinate. Urination is known as micturition. It's a little easier to say urinate, right? But it's just the urination or voiding, moving that urine from the urinary bladder out to the external environment. So as I mentioned the sphincters a while ago, you should have realized that micturition or urination is a combination of involuntary and voluntary muscle contractions. So when the volume of the urinary bladder gets somewhere between 200 to 400 milliliters, the pressure in the bladder increases, and stretch receptors that are located in the wall of the bladder are going to send nerve impulses to the spinal cord. These impulses then are going to cause contraction of the detrusor muscle. Remember, that's the muscle that surrounds the bladder. And it also causes relaxation of that internal urethral sphincter. So when contraction of the urinary bladder wall and relaxation of both sphincters occurs, not just the involuntary internal urethral sphincter, but the voluntary relaxation of the external urethral sphincter by your choice, that's when urination takes place. Emptying of the bladder is a reflex. So in early childhood, we learn how to control that, to initiate it so that we urinate it, or so that we urinate, and also to stop it by voluntary control of that internal or of that external urethral sphincter. Now, when we move into the reproductive system, you're going to see that in the male, the urethra has two purposes. Not only is it used to empty the bladder, urination, but it is a common tube for ejaculation as well. Since we mentioned that male urethra and its dual function, I thought this would be a good place to put a comparison of the male and female urethra. So in the male, the urethra is about 8 inches long, and it runs from the urinary bladder through the prostate gland, through the root of the penis and the shaft of the penis. And the name of the urethra changes as it does so. It's still the urethra, but it's named with an adjective that describes where it's located. So the prostatic urethra runs through the prostate gland. The intermediate or membranous urethra is a very, very short little segment that passes through the perineum, and then you have the spongy urethra that runs through the erectile tissues of the penis. In the female, the urethra is much, much shorter, and it is simply a urethra. We don't change the name of it. It opens anterior in front of the vaginal canal, and there's only one function for the urethra in the female, and that is to expel urine.